Come in.
Hello, how are you today?
Good, how are you?
Good, my name's Haley. I'll be your student nurse. Can I get your name and date of birth, please?
Natalie Caldwell, 10/20/97.
Okay, perfect. And I went ahead and I've gathered all of my items to perform this head-to-toe assessment. I'm going to go ahead and I'm going to perform proper hand hygiene and don gloves and provide privacy. Alrighty, Natalie, so you are here. Are you experiencing any pain? And if you are, we're going to do it based off of a 0 to 10 scale, 0 being no pain, 10 being the worst pain you felt in your life.
0.
0, okay, perfect. And just a little summary about what we're actually going to do. We're going to do a head-to-toe assessment, pretty self-explanatory. We're going to be assessing you from your head to toe, everything from your cranial nerves to just vitals, range of motions, things of that sort, okay? And now, could you repeat your name, please?
Natalie Caldwell.
Okay, and do you know where you are?
I am in your house.
Okay, and then do you know who the president is?
Donald Trump.
All right, perfect. And we're gonna go right off the bat. I'm assessing the patient, I'm inspecting her. She is with good hygiene, she is comfortable. I see no guarding, she has no lumps, lesions, anything of that sort, just from the eye's view. Her pallor is good. I'm going to then assess her skin. Skin is moisturized, temperature is within normal limits. She feels warm, skin is dry. I'm going to go ahead and assess her turgor. Patient has good turgor. She is hydrated and moisturized. And we're gonna go ahead and move just right on to the cranial nerves. So I'm going to assess her head, look for any lumps, lesions, any masses, abnormalities, anything like that, lice, dandruff. I don't see anything, everything's within normal limits there. Then we're gonna move on to her lymph nodes. So I'm just going to inspect and then palpate those. No swellings noted here. Alrighty, okay. And then we're gonna move into the cranial nerves like I stated. So the first cranial nerve is the olfactory nerve. And that is nerve number 1. We're going to be assessing her smell. If you could just go ahead and close your eyes and cover one nostril, thank you. And could you tell me what you're smelling?
Chocolate.
All right, could you do the same thing with the other one?
Chocolate.
All right, perfect. Sense of smell is intact. And then we're going to move on to the optic nerve. That's going to be done. We're going to have the patient read from the book 14 inches away. Could you just read the top line here?
Bafflement, criticism, snorting every time you talk about your new.
Okay, thank you. And that is correct. Alrighty, and we're gonna move on to the Snellen. That's going to be read from 20 feet away. Could you please just read the top 2 lines?
TZOPTOC.
Okay, perfect. Patient's cranial nerve 2 is intact. And now we're going to move on to cranial nerves 3, 4, and 6. That's going to be the ocular motor, the trochlear, and the abducens. This will be done assessing the patient's perla, meaning pupils are equally round, reactive to light and accommodation, also using the 6 fields of gaze. And all right, let's get started. So if you could go ahead and just look forward, please. And while I'm doing this, I'm going to be assessing each of her lights at the same time to see if they're both equally reacting to the light, which they are. Pupils are equally round and reactive to light. They are within the 3 to 5 normal limits of millimeters. And then if you could just follow my pen light, please. Perfect, performing the 6 fields of gaze, that was within normal limits. And then we're gonna have you just look at the pen, please, and follow it in. Thank you, no signs of nystagmus, all motor functions are intact. We're going to move on to cranial nerve 5, which is the trigeminal. This is going to be assessing the facial sensations. We're going to do that by touching 3 different points on your face, the forehead, the cheek, and the jaw. If you could just tell me if you feel hard or soft and exactly where you're feeling it on your face. Could you please close your eyes?
Soft left cheek. Hard right cheek. Hard right forehead. Soft right jaw. Soft left forehead. Soft left jaw.
Okay, thank you. Perfect. Alrighty, now we're going to move on to cranial nerve number 7, and that's going to be assessing her facial movement. So if you could smile, please. Grin, or yeah, frown. Raise your eyebrows and puff out your cheeks. All right, perfect, looks good. We're going to move on to the acoustic, that's cranial nerve number 8. We're going to do this by performing the whisper test. If I had a tuning fork, I would do the Weber test. We'd place it on the patient's head and she would let me know if it was evenly distributed throughout each ears, or the Rhine test to check air conduction versus bone conduction. So if you could please turn around. Thank you. And will you just cover up your left ear and then repeat what I'm saying?
Apple.
All right, and the next one?
Cat.
Okay, perfect, thank you. And you can turn back around. Cranial nerve 8 is intact, and now we're going to assess cranial nerve 9, 10, and 12. That would be the glossopharyngeal and the vagus nerve, along with the hypoglossal. This is going to be dealing with sensory on the tongue, different tongue movements, gag reflexes, and swallowing. All right, so if you could please just open your mouth, say ah. Okay, and you feel it does move up and down, and noting that the patient's able to swallow and stick out her tongue. Could you stick your tongue out, move it left to right, and up and down? Perfect. And stick your tongue out one more time. And are you tasting anything?
Yeah, it tastes like sugar.
Okay, perfect. Sense of taste is intact. And finally, for the last one, we're going to move on to the spinal accessory. If you could just please shrug against the resistance. Thank you. And push against my hand. Thank you. Again. Alrighty, all cranial nerves are within normal limits. They are intact, no abnormalities that would be noted. And we're going to move on to the upper extremities. So I'm going to take your pulses. Alrighty, so the brachial pulse and the radial pulse are both present. They are +2, no bounding, no threading of that sort. And then we're going to go on. I'm going to assess and auscultate her carotid. Now, if you could please just hold your breath. Thank you. No whooshing, no swooshing, no signs of any breweries. I'm going to just palpate the carotid now. Alrighty, looks good, sounds good. And we're going to move on to the 5 different cardiac points. First, we're going to use the diaphragm, and then we would use the bell. We're going to do the first one, the aortic, pulmonic, herbs, tricuspid, and then the mitral, also known as the apical pulse, which we would take for 60 seconds, and we would go back and do the same thing with the bell. Alrighty. And since we are taking pulses, I'm going to go ahead and do the vital signs. Vital signs are going to be dealing with and encompassing pulse, oxygen levels, respiration rates, blood pressure, and temperature, which we've already assessed her temperature also. Now we're going to go on to the auscultating of the lung sounds, which we would perform by doing 8 on the front and 10 on the back. So I'm gonna go ahead and listen for those in a ladder formation, so we're able to compare symmetry. If you could just breathe in and out. Thank you. Again. Okay. If you could go ahead and turn around, please. Make a more barreled chest so I can get a better reading. Alrighty, thank you. You can have a seat, sit back. Also, I was doing this, I was assessing the patient's breathing. The rise and fall bilaterally were symmetrical, no abnormalities. I didn't hear any wheezing, any crackles, any rhonchi, anything like that. Also, how are you feeling right now?
Doing good.
You're good? Okay, no problem. So we're gonna move on to the abdomen. And I've assessed the patient's skin. I would have the patient take off her clothing to do this so I could get a more accurate reading also while performing the auscultating. And I would assess her stomach, blah, blah. And we're going to move on to auscultating the abdomen before percussing. We're going to start with the right lower, right upper, left upper, left lower. Vowel sounds are present. Now I'm going to go ahead and percuss and palpate. I do not feel any lumps, masses, lesions, I don't see any lesions, nothing abnormal there. Then we're going to move on to the range of motions. If I could just see your hands. Can you squeeze for me? Thank you. And then can you pull up? Thank you. Push down. And then can you put your hands out to the side? Bring them up. Thank you. Back down. Here. And then up again. And just pull towards you. Perfect. Okay. We're going to move on to the lower extremities at this point. If you could go ahead and put your legs up. Thank you. And I'm going to assess her pulses. This is the dorsalis pedis. And I do feel the pulse. It is +2, no bounding, no threading there. We're going to move on to the posterior tibial, which is located inside. And pulse is there, present. We're going to move on the popliteal. Alrighty. Impulse is present there as well. I would also note that I would do the femoral artery at this point. I'm not going to do that. Also, I would do the genitalia, or I would ask the patient if she's having any issues with that, any discharge, any rash, anything like that. Are you fine in that area? Perfect. Okay. And I'm going to note the patient's skin and pallor is correct. She has the correct color. She is moisturized. She has good temperature. Nothing abnormal there. Alrighty. And we're going to have you do a few exercises. If you could push with your feet. Thank you. Pull up. All right, perfect. Could you take your left leg, bring it up to your chest? All right, and the same with your right. Okay, and now we're gonna move on to assess your gait just to see how you walk. So if you could come over here, please. Actually, I'll have you walk this way. Just walk towards me. Okay, turn around, walk the other way. Patient steady with gait, no, nothing wrong here, able, swift. And then I'm going to have you face the camera, close your eyes, and I'm going to just assess her balance here. And I'm going to go ahead and push on you, and could you just resist? All right, again. And I would do this for 20 seconds to assess her balance. She does have good balance here. Her gait is, as I said, steady within normal limits. If you could go ahead and have a seat, please. All righty, thank you. And I would look for any tubings or anything like that. I would assess any of those, anything coming out of her body. And then I would document all the findings as I was doing them, or I could do it later, whichever I'm more comfortable with. Are you needing anything right now?
I'm okay.
Okay, and I would leave the bed in the lowest position with her call light and let her know that I would be there if she needed anything.